Maria Holder Diabetes Center.
Lifestyle changes can be just as powerful as medication in controlling diabetes.
If controlling your diabetes is what you're interested in, you have tuned in at the right time to hear 15 diabetic-friendly minutes on VOB 92.9 FM, all with the compliments of the Barbados Diabetes Foundation.
So what can you tell me to help me controlling diabetes this morning, boy?
Yeah, Victoria Cox, that is you. I see you for a long time. What are you talking about today?
We're going to talk about how to look and feel your best for the upcoming crop over season.
I getting ready for crop over season. I gotta listen to that.
We do actually see a significant number of vein ulcers in persons with diabetes, and we want people to understand how to prevent and how these are managed.
Dr. Diane Brathwaite on how to prevent and manage vein ulcers. All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that can get you ready to achieve your financial dreams.
I'm ready.
Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic, or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
Good Saturday morning, VOBers! Peter Boyce here. Tomorrow is the last day in May, and if you are diabetic or pre-diabetic and you have not visited the Maria Holder Diabetes Center yet for the year, what are you waiting for? Or as a popular Californian would say, just a little taste of the song we have coming up for you later. But seriously, what are you waiting for? If you've not done it between January to May, bright and early in June, you need to make an appointment to get an eye screening for diabetic retinopathy, or a vascular screening for if you feel you may have bad circulation, or book an appointment to see registered dietitian with the Maria Holder Diabetes Center, Victoria Cox. And you know, Crapova is in the air. You've been hearing the music on VOB and you're getting in the mood. Well, Victoria Cox has some tips for you for the coming Crapova season. So let me welcome Victoria.
Hi, this is Victoria, the registered dietitian at the Maria Holder Diabetes Center.
Hi, Victoria!
And we're going to talk about how to look and feel your best for the upcoming crop over season. So we've got 3 quick tips for you today. Number 1, unsurprisingly, stay hydrated. It's going to help you feel energized, feel less bloated, just have you feeling ready to go for the road. So stick to mostly water, maybe a little bit of coconut water, but try to avoid having lots of sugary beverages. And if you're going to be drinking alcohol, balance that with lots of water in between. Okay, number 2, make sure to have lean protein at every meal that you're eating as we're kind of approaching the season, and just in general. Lean protein, we're not talking about deep fried greasy meat, we're talking about baked, stir fried, grilled, chicken, fish, egg, tuna, things like that. Protein does a really good job at keeping you fuller for longer, so you're going to be less inclined to snack on things that maybe you shouldn't be snacking on in between, that again don't make you feel your best. And then lastly, it's more just about planning ahead for your meals. Now this doesn't mean that you have to be social media's version of meal prepping everything you're going to eat for the next 7 days, but always have a mental plan in mind for the meals that you're having the next day, and follow a basic breakdown, right? Think to yourself, lean protein, a little bit of high fiber starch, and please some kind of vegetable or salad. If you want to get nitpicky, make the veggie salad the largest component of the meal. Eat it first to get that fiber, in your digestive system first. Helps keep blood sugar steady, keeps you feeling full, and always have options in mind. So think about, okay, what are my proteins at hand? What high fiber carbohydrates do I have? What's my veg situation at home? And mentally plan your meals in advance, because winging it doesn't tend to go that well. Have fun and stay safe.
Thanks for those tips, Victoria, so that VOB people can have some fun and stay safe for the coming crop over season.
Wait, I hear Dr. D yet. I'm ready to hear Dr. D.
Dr. Diane Bradford is coming up next.
Good.
And she is going with part 2 of her vascular issues presentation that she started last week.
You listened last week?
Well, you should have been listening. And this week she started off talking about swelling.
So hi, Dr. D.
So why is swelling so important? Remembering that the issue with the valves is most common. If you have an issue with the valve, it's going to be a long-term challenge that you may have to deal with. So first of all, you need to know, well, which valve is it? Is it something that's correctable? And there's a special test that can be done to see whether it is a correctable lesion or not. That's a venous reflux test, and sometimes your doctor might discuss with a vascular specialist or a circulation specialist whether anything can be done, or they may just refer you for an opinion. If you are a young person, we generally advise you to get a referral, because it's always best to diagnose these things early, meaning before the swelling has been there for an extended period of time and the issue can't be rectified. But the most common treatment for swelling due to valve incompetence is actually going to be compressions. So compression socks or compression stockings. Now the strength of the compression, if you're dealing with a stocking, depends on how much swelling you have. Can you see the veins? Are there skin changes? What else is going on? So there are different strengths that have to be used, and you will need to discuss with your healthcare provider what strength you need. Sometimes people go and buy the lightest compression, but if you have significant swelling, that may not deal with the problem. So don't forget, get the opinion of your healthcare provider. Stockings are also based on the measurement of your leg, and it can come in below the knee, above the knee. You can have ones that are pantyhose as well. Okay? When you have protracted swelling on the skin, what can happen with the skin is the skin can become unhealthy, because the swelling or the fluid stretches the skin away from a healthy blood supply. And you may notice that you start to get darkening of the skin, tightening of the skin. There is a phrase, and that is the inverted wine bottle look, meaning that the ankle becomes very narrow and the calf looks a little bigger. And that is something that is characteristic of chronic vein incompetence that obviously has not been dealt with adequately. So it is important to use your compressions. It is important, if you are using compression, to put it on early in the morning before the swelling has started. Then you take it off in the evening, and you generally do not have to sleep in compressions. Okay, so remember, early in the morning before the swelling starts. If you put it on later in the day and the swelling is already there, it won't deal with the issue at hand. Swelling that's there for a long period of time with associated skin changes can predispose to ulcers, or chronic venous ulcers or chronic vein ulcers. This is something probably that used to be called life sores, and I think it probably was referred to that because maybe they were hard to get them to heal. If you notice that you have changes to your skin and you have swelling, you really want to go and see somebody before that skin breaks down into a sore, because for many people, getting that sore to heal quickly can become quite difficult. And then of course, if you have diabetes and high blood sugars on top of it, or you have other complications related to diabetes, it can be even harder to get it to heal up. However, if you have a wound due to veins or even an irritation, it is possible to get it to settle down by using some special compression dressings. But of course, once again, discuss with your healthcare provider if that can be done, how it can be done. In some mild cases, sometimes a dressing will be used with your own compression, but if it's more serious or has a lot of associated skin irritation, a compression dressing might be used instead. And we actually use multiple layers of dressing to compress the veins to push the fluid back out to the legs. So while not only related to diabetes, I think this is important to know because we do actually see a significant number of vein ulcers in persons with diabetes, and we want people to understand how to prevent and how these are managed, especially if you're living with diabetes. Okay, so no ulcer is a good ulcer when we're dealing with diabetes or circulation problems. So remember, prevention is always better than trying to cure it. Take care of your feet. You need them for good health and to be independent in the long term. And if you are having swelling of your legs, make sure you get a professional opinion. I hope some of this information has been useful to you today. I want to wish you a very happy weekend. Remember, get your regular foot screening and foot checks. Take care of your eyes. Take care of your kidneys. Get your checks regularly. Make sure blood pressure is well controlled. Make sure cholesterol is under control and to the target recommended for you. And just take good care of yourselves. Bye-bye.
Bye-bye, Dr. D. As we go into our Saturday song of the day on the theme of what you are waiting for, that you have not visited the Diabetes Center yet, we go to a classic golden calypso this Saturday morning. This is the Mighty Rouser with What Are You Waiting For? Compliments the Maria Holder Diabetes Center and Republic Bank.
This beloved country will one day soon have large government farms.
The Maria Holder Diabetes Center.
What are you waiting for? They'll succeed with workers in charge, provided they don't fall in private hands. What are you waiting for? What are you waiting for? What the rich man in third world countries done with it wreck up so it can last. What are you waiting for? What are you waiting for? Like we railroad, then we foundries, now we try to keep going fast, fast. What are you waiting for? What are you waiting for? Don't play with we, cause we wide awake. Then we research and develop, for goodness sake. We wanna do it with you, but if we must, we gonna do it with self, fuss or no fuss. What you waiting for? Tell me what you're waiting for. Is what are you waiting for? We got to know what you're waiting for.
Contact the Barbados Diabetic Eye Screening Program today at 243-EYES, 243-3937 to find out how you get your simple digital eye screening done. The Maria Holder Diabetes Center.
We now welcome a patient of the Maria Holder Diabetes Center, Mr. Paul Edwards.
I've been a patient of Maria Holder Diabetic Center for probably about 7 years now. To cut a long story short, I couldn't have done without them. Even when, the going was tough, Diane helped us with some, medicines and made sure that we all got, what we needed to keep going and to control our diabetes. This facility is top notch. But the long and short of it is, Barbados for many, many years has been known, and sadly, I'm sure that this reputation is getting a lot better. It's always been known as the amputation capital of the world, which is really sad. But with the help of, everybody that works at the Diabetic Center, I think we've kind of moved a little bit forward from that now, because you can get help. I would advise anybody in Barbados who just thinks they may be a diabetic to go to the Diabetic Center. I have nothing but high praise for it.
Cutting-edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
Diabetes doubles your risk of heart disease. Know your numbers today.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality. You can do anything.
Holder Diabetes Center.